My name is Dr. Valerie Lyon, and I'm a medical doctor, and I'm board certified in general dermatology and pediatric dermatology. So I got into the medical field because my father was a doctor, and I saw what he did, and I saw how he took care of people and how he taught people, and it was something I really wanted to be and something I really wanted to do. I chose dermatology at the end of my third year of medical school. So I went to one of my favorite places, the library, and got all the books in stacks and just sat there and just read, and dermatology was it. I couldn't put it down. It had everything. So I got into doing both specialties because general dermatology, I did a fantastic residency at a great place, and I learned a ton. But there's a lot more to know about kids, and especially if you want to be the expert in it, there's a lot more to know about kids in a lot of detailed ways. So I had a really good mentor when I was in general dermatology, and she was a pediatric dermatologist, and she pointed me to train at a place where she knew that I would get the best information and everything I needed to be even more of an expert in taking care of kids too. So we see everything in my office from newborns to older people, people in their teens, college years, right on up to adults, and even up to people in their hundreds. So I think one of the first things we try to do with parents, with anybody, is just kind of review and come from a place of understanding. And then with the parents in particular, it's a lot of giving information. Just a ton of information about what it is, what we're doing here, what you can do at home, how we can change the environment to get things better, and then as much information as you need and want to absorb to get you to that next point of, having a healthy baby, healthy home environment, and everybody is doing well. So it's really important to listen to the patients, and I know that phrase is used a lot, but the patients always have the answer. So they come in with a certain amount of information that has already happened, and you can benefit from all that knowledge and what they have done so far to really understand where to go with it and what they need. So the biology, you start with the science and the biology, but then you really have to take into account all the other factors in the environment and that individual's history and what's been going on with them, and you really have to mold the two to get to something that's more meaningful and something that's actually going to make a big difference for them. So I really love learning about dermatology, and that will never end. I can never get enough. I can never know enough. I can never learn enough, and it's exciting to me to this day. Even the littlest thing that we can improve upon, that we can make better, it's just still fascinating to me, still thrilling. And sometimes even the littlest difference that we can make is such a big deal. I really, really love being part of people's journey. And sometimes it doesn't start at the best place when people are feeling badly about themselves, and sometimes are, ashamed or don't want to talk about things. And it's really nice when we can come together and establish some mutual understandings and get to know more about the condition, get to know a little bit more about the style and how we can approach things kind of in a stepwise fashion. And when people come around, which inevitably, could be that day, could be in a week, usually people really benefit and can see the benefits and feel a lot better. And it's super rewarding, not just for them, but for me as well. I love the people. I love the variety. I love everybody who comes in that's a little bit different and coming from a different experience and has different want or a different need, and I just love discovering that. And then I love to see them get better. I love it when people come back and life is better, life is new, and life is beautiful again.